How is it that you treat arthritis in the middle of your foot? That's what we're going to talk about today. So let's talk a little bit about this condition called midfoot arthritis. Arthritis can happen in a lot of different places. Specifically, you can see this patient has it in the middle of the foot where instead of being nice and smooth, you're going to see these bumps right here and the bumps right here. This is arthritis in the big toe joint, which is called hallux limitus. I'll put a little link underneath it. There's some videos I have on hallux limitus as well, but this is midfoot arthritis. It's arthritis in these joints in the middle of the foot, and we're going to talk a little bit more how you can treat that. The first thing you have to ask yourself is, how long have you had the symptoms? It tends to be the longer you had it, the worse it becomes. And what treatments have you tried? Have you tried any cortisone injections, any icing, any anti-inflammatories? Does it hurt you all the time? And how does it impact your life? Is it hard to tie a shoe? Is it hard to push on the area? Can you not bend down or squat down? Or what does it hinder you from doing? So I want to go over today what you have, why you have it, and how you can treat it. Let's talk a little bit about arthritis. So arthritis in the middle of the foot affects all of these joints. You see these little red lines here? Those are all the joints, and there should be joint space. If there's a lack of joint space, that's going to be arthritis. So once again, in the middle area of the foot. How do you look at it? Well, the diagnostic exam is going to be an X-ray or a CT or an MRI. Here's an example of an X-ray, and you can see the spurring on the top. Once again, it looks like mountains on the top of the middle of the foot. If you look at the top down on this X-ray, these are normal joints. You see those little black areas? That's the cartilage. Well, there's nothing here. It's basically white, and that's bone on bone. And you can also see this on the CT scan. So, first of all, you're going to push on the area to see if it hurts. It's going to hurt if you bend the foot or twist the foot, and then you can look at the x-rays. What are the options? You can ignore and hope it goes away. You can do conservative treatment or non-surgical treatment, or you can do surgical treatment such as a fusion. We're not going to talk too much about surgery today, but we're going to talk about some of the non-surgical treatments. How long does it take to get better? Everyone wants to know. Well, if you've had pain for over 3 months, meaning for years and years and years, you might find some improvement in 3 months. If you can help with the arthritis. If it's under 3 months and it's just started, sometimes we can get you better in a month. The process is to reduce the pain and control the load. The load is key. That's going through those joints. The less load you have, the better it's going to feel. You want to repair any injured tissue. You can sometimes repair the tissue around the joint, but you really can't repair the joint itself. It's very challenging. There are some new treatments that can sometimes help, but there's really no guarantee with it. And then you want to kind of restore as much as you can the proper function. This is the checklist that we're going to go through, and I review this frequently with my patients. So if you want to stick around, we're going to be going through all of these types of treatment options. So first of all, anti-inflammatories. I recommend starting with a 2-week course. If your doctor will allow you of an anti-inflammatory. I personally like Aleve, 2 Aleve, twice a day for 2 weeks. If that doesn't work, with arthritis, normally it doesn't. You have to try something else. Go on to the next thing. Icing. This is an example we use for plantar fasciitis, but you can do a contrast bath. So a bucket of ice water and a bucket of hot water, 5 minutes one, 5 minutes in the other, 5 minutes in the other in the ice, or icing on the area. The issue is, will anti-inflammatories and will icing resolve your issue? Usually not. I want to be very clear. If it's arthritis, it's not going to help the best. Now, wearing a stable shoe and an insert a lot of times can help because it reduces the movement in those joints. The more that those joints move, the more it's going to hurt. So you want to reduce the stress and strain. You can also try an alternate lacing method, kind of like this. You basically, where it hurts in the middle of the foot, you skip those laces. And for some people, that can help them. Now, being aware, a lot of these patients have flat feet, so a very stable shoe is going to be better than like a flimsy shoe. This is one of those advanced treatments that I talked about called Shockwave. What it uses is radial shock waves, and this is an example on the heel, but you can do it just as easily on the middle of the foot, and that doesn't bring back cartilage. What it does is it reduces the inflammation around the joints, and sometimes it can help for arthritic pain. Okay, there's radial and there's focus shockwave. Here are some of the benefits here you can read, but basically it reduces pain and inflammation around those. Does not repair cartilage, hard to repair cartilage, but for some patients, they're just looking to get rid of the pain. If you don't want to do the shockwave or your doctor doesn't do it, sometimes you can do a cortisone injection. Once again, this is an example that we use for the heel, but you can do it just as well with ultrasound guidance to the middle of the foot. Orthotics can be helpful as well to relieve high pressure areas, reduce the internal stresses. This is key, reducing that internal stress. So if you have a foot that's flattening all the time, that flattening, see how it's putting pressure on the middle of the foot in those joints, and that is going to cause increased strain in the middle of the foot. And then finally, reduce the excessive abnormal joint movement. The more the joints move, the more it's going to hurt. So everything we're doing is at reducing this. So first of all, you try the stable shoe, then you try the orthotic, and then from there, you can try a brace. This is one of my favorites. It's called a DonJoy Velocity Brace. And what it does is it puts pressure to the lower leg region, and it doesn't allow your foot to go side to side. It goes up and down, but it doesn't go side to side. And that many times reduces that twisting motion that can be painful. And then wearing a walking boot. Sometimes we put people in a walking boot. Compression stocking can sometimes be helpful as well. Not usually like curing things, but makes it feel better. And then for a lot of our patients, let's say we do a cortisone injection and you do one a year or every couple of months and it still hurts and you want to try something else. These are called braces or ankle foot orthotics or just a foot orthotic. This is called a meso brace. It reduces just in the middle of the foot. This is something very low profile, can fit in the shoe pretty easy. My patients do well with this in the middle of the foot. Here's an example of an Arizona brace. These are two different types. These restrict the movement. Once again, you lace it up. It doesn't move the joint. And if the joints don't move, it's going to feel better. And then this is another called a medial blaze brace, and this prevents flattening of the foot. And by reducing the flattening, it helps the foot feel better. If you have really bad arthritis, one of these other ones tend to work a little bit better. If you have just a flat foot and tendinitis, this tends to work better. And then there are some advanced treatments for this. This isn't plantar fasciitis. This is midfoot arthritis, but Shockwave, amnio, platelet-rich plasma, and then surgery. Okay, so here are the treatment checklist. Basically, I would start with an x-ray, maybe a diagnostic ultrasound. If nothing is getting better and you're considering surgery, I would get an MRI. Shockwave can sometimes help. I would try a few treatments to see if it helps. Amnio injection, some of my patients do well with that in the joints. And then cortisone as well at times. Sometimes I put people in a boot to really rest it. Anti-inflammatories, not really good long-term for treating this. Physical therapy, not really, not going to help this. If it maybe you have tendinitis or other things that are going in conjunction with it, but PT doesn't really resolve arthritis. So going in this order, supportive shoe, custom orthotic, ankle foot orthotic, and then a walking boot. These are all increasingly more supportive, and then possibly surgery or a second opinion. Once again, I hope you guys found this helpful. A lot of information about arthritis. Let me know what you think and what's worked for you for your arthritis in your foot. Hi, I'm Dr. Don Pelto. I'd like to welcome you to my YouTube page. And on this page, you're going to find a lot of resources that I've set aside for you if you are my patient or if you're here just learning about your foot condition. I'd like to give you a little tour and share a little bit about what we have to offer on this website. First, I've had it organized by my patient resources. These are resources such as our office newsletter, our webinars that we do, or different types of things I'm providing specifically to patients in the office. As you scroll down, what you'll see is a section that's called Ask Dr. Pelto. You can submit your own question and I'll answer it in one of these episodes. And then what you'll find are a list of videos based on topic under the foot problems. And at the end, what you're going to find are my books. Put a little link here on the upper right-hand corner. If you click that link, you're going to get a link to my website. And on here, you're going to find a list of my books. I want to thank you for visiting drpelto.com on my YouTube page, and I look forward to helping you or educating you with this information.